Go back in time when we talk about misinformation and disinformation. Remember COVID? Well, the deep state at that time, where they had a lot more control, they used through the fake news, they used misinformation and disinformation against Trump. Trump was trying to do the right thing. And when people say, oh, what did he do? Well, he mentioned hydroxychloroquine multiple times. He actually took hydroxychloroquine multiple times. Do you know if we had hydroxychloroquine and the fake news, the fake doctors, the corrupt medical system, if they really cared about the American people, they would have used hydroxychloroquine. But then again, the pharmaceutical companies, they wouldn't be able to inject everyone with a bioweapon. Then again, they wouldn't be able to make billions of dollars. Then again, they wouldn't have depopulation. They wouldn't be able to make everyone sick and then sell more drugs to try to cure what they caused. But if we go back in time, Trump let everyone know. He let everyone know that there is an effective treatment, not just for COVID, but for flu and many other things. Take a listen.
They use the hydroxychloroquine, and they can also do it with Zpak, subject to your doctor's approval and all of that. But I hope they use it because I'll tell you what do you have to lose? In some cases, they're in bad shape. What do you have to lose? It's been out there for a long time, and I hope they use it. And they're going to look at with doctors, work with doctors, get what you have to get. But we have it stockpiled, and we have a lot of it. And one of the reasons that I keep talking about hydroxychloroquine is that the question that nobody ever asks, and the question that I most hate the answer to, is what happens if you do have a ventilator? What are your chances? And I just hope that hydroxychloroquine wins, coupled with perhaps the Zpak, as we call it, dependent totally on your doctors and the doctors there. Because you know the answer to that question. If you do have the ventilator, you know the answer to that question. And I hate giving the answer. So I don't want to get them there. I don't want to get them there. There's a possibility. And I say it. What do you have to lose? I'll say it again. What do you have to lose? Take it. I really think they should take it. But it's their choice. And it's their doctor's choice or the doctors in the hospital. But hydroxychloroquine, try it if you'd like. The other thing, if you have a heart condition, I understand, probably you stay away from the Zpak. But that's an antibiotic. It can clean out the lungs. The lungs are a point of attack for this horrible virus. But when you have a ventilator, don't ask the answer because I hate it. If you have it and it's working beautifully, I don't like the answer because it's not a very high percentage. So I want to keep them out of ventilators. I want to keep them, if this drug works, it will be not a game changer because that's not a nice enough term. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works. Because when people go into those ventilators, you know the answers, I know the answers, and I'm glad you don't write about it.
But again, the people, they had to make their own decision. There are many people that decided to go get hydroxychloroquine. There's many people that decided to use ivermectin. And there were many people that believed the fake news. But you could see that that's all turning around. Since COVID, the fake news, they have lost their people. They have lost the narrative. The deep state have lost the people.